Good morning, everyone. We are from SGD B9. We would like to present our student project titled Color Vision Test. So here is our dream from SGD B9. I'd like to introduce myself first. My name is Niluputu Mahaputri Kayika with the last three-digit number 155. So color blindness is a condition where a person is unable to distinguish certain colors in a normal way. Based on Riskestas data, the prevalence of color blindness in Indonesia in 2007 was 0.7%. Currently in Europe, around 8 until 12% of men and 0.5 until 1% of women are colorblind. Color blindness mostly affects males because it is genetically linked to the X chromosomes. The current level of mobility and busyness results in low awareness and lack of public knowledge about color blindness, as well as carrying out color blindness tests from an early age. Therefore, comprehensive knowledge about color blindness and color vision tests is needed. Based on the background, the problem identification of this paper as the following. What is color blindness? What is the classification of color blindness? The etiology, pathophysiology of color blindness, treatment and prevention of color blindness. What is the Ishihara test? What is the Hardy-Reinreitler test? What is Farnsworth Mansell 100 hue test? And what is the FMD 15 test? Based on the problem identification, the purpose of this paper as the following: to understand the definition of color blindness, classification of color blindness, etiology and pathophysiology of color blindness, treatment and prevention of color blindness, to understand the Ishihara test, Hardy-Reinreitler test, Farnsworth-Mansell 100U test, and the FMD15 test. There are multiple benefits gained by medical students from this student project, including being able to comprehend the definition of color blindness, classification of color blindness, etiology and pathophysiology of color blindness, the treatment and prevention of color blindness, Ishihara test, Hardy-Reinreitler test, and Farnsworth-Mansell 100U test, and the FMD59 test. For scientific learning, this paper can be a more in-depth review of color vision tests. And finally, the community can increase their knowledge about the color vision test by reading and understanding this paper.
In this chapter 2 literature review, we're going to discuss about definition and classification, etiology and pathophysiology, treatment and prevention of color blindness. We're also going to discuss about the color blindness test method like Ishihara test, Hardy-Reinreitler test, Farnsworth-Mansell 100Q, Farnsworth-Mansell D15. My name is Anastacia Andrea Tanberius and my last three-digit numbers are 154. I'm going to start with definition and classification. Color blindness is a visual impairment that causes an individual difficult to distinguish and perceive colors or color combinations. It is usually an inherited condition caused by genetic mutation in the X chromosomes. It is damage of color reception nerves like cone cells. There are three types of cone cells: blue, green, and red. Color blindness can be classified into protonomaly, deuteranomaly, tritanomaly, protanopia, deuteranopia, and tritanopia. Protonomaly is where there is a weak red color perception, where the people with this type of color blindness has difficulty detecting shades of green and red. In deuteranomaly, there is weak green color perception, difficult differentiating shades of green and red. They may see the colors as gray or brown. In tritanomaly, it is difficult to distinguish between blue and yellow colors. Protanopia is a severe form of protonomaly. Deuteranopia is a severe form of deuteranomaly. And tritanopia is a severe form of tritanomaly. Thank you.
Greetings, doctor and friends. My name is Bonifasius Alvianto Pamungkas with lesson number 137. And in this occasion, I want to explain about the etiology and the pathophysiology of color blindness. So there are two things about the etiology and the pathophysiology. First of all is genetics. Color blindness is a pass through chromosomes or groups of genes. The genes that can cause red-green color blindness is the X chromosome is where the genes that might cause the red-green color blindness are handed down. Both men and women are equally affected by blue-yellow color blindness and full color blindness, which passes down on other chromosomes. And the second one is disease or trauma. Injuries to your eyes or the area of your brain that plays a role in color perception can also result in color blindness. This may be caused on by disorders of the eyes, glaucoma and macular degeneration, illnesses of the nerve system and brain, multiple sclerosis and Alzheimer's, and some medications such as plaquenil and brain or eye injuries. Thank you.
Hello, I'm Amanda Devasya and my last three digits of the number is 068. And now I will explain about the treatment and prevention. Until now, there has not been found a way to treat color blindness, except for color blindness caused by side effect of taking certain drugs or eye conditions. However, people with color blindness can use color filters over glasses or color contacts to help improve the perception of confusing colors. People with color blindness can do the following ways to recognize colors. First, memorize the order of important color objects, such as traffic lights. Second, provides a color label on an object. Third, organize clothes in the wardrobe or drawer by color. Next, use an app on phone to help identify colors. And also use bright light at home to clarify the existing colors. There is no way to prevent congenital color blindness, but the risk of color blindness can be reduced by checking eye health at least once every 6 months, regular control to the doctors, and adopting a healthy lifestyle, one of which is consuming healthy foods. That's all from me. Thank you.
My name is Nibbana Siva with class 121 and I'm going to present the definition of Ishihara test. Ishihara test is one of the most frequently used tests for color blindness testing. The Ishihara test is a color perception test made specifically to detect color deficiencies, especially for red and green colors. In this test, 38 plates will be provided containing dots of different sizes and colors. These dots will form a number or pattern. For individuals who do not have color vision deficiency, it will be very easy to identify these numbers and patterns. But for people who have color vision deficiency, it will be difficult to identify these plates. Ishihara color plates have several types. The first type is the demonstration type. Both individual with normal vision and color vision deficiency individual can identify the plates because the function of these plates only to demonstrates how the Ishihara test works. The second type, transformational plates. In this type, usually people with normal vision will have different identification answer from those who have color vision deficiency. On vanishing plates and hidden digit plates, people with color vision deficiency cannot identify number or patterns, and the last type is diagnostic plates to help diagnosis process.
My name is Devasya Sakarajasarikanini with the last three digits of the number 188. Now I will continue the presentation with Ishihara test indications. So colorblind test can be performed when you find indications of color blindness, such as difficulty seeing colors and their brightness, frequently encounter color perception discrepancies, and inability to distinguish between shades of similar colors. While the symptoms that should be looked out for in children include improved sense of smell, improved night vision, increased sensitivity to bright light, reduced attention span when coloring, exclusively coloring with the wrong colors, and head or eye ache when looking at red on green or green on red backgrounds.
My name is Mahesa Ajisaka Aryasa with the last three digit of my student number is 230. And today I will continue to the procedure of Ishihara test. So the plates are designed to be appreciated correctly in a room which is lit adequately by daylight. The introduction of direct sunlight or the use of electric light may produce some discrepancy in the result because of an alteration in the appearance of shade of color. When it is convenient to only to use electric light, it should be adjusted as far as possible to resemble the effect of natural daylight. The plates should be held at a distance of approximately 70 centimeters from the subject until so that the plane of the paper is at right angle to the line of vision. The numerals or symbols which are seen on plates are stated, and each answer should be given without more than 3 seconds delay. It is not necessary in all cases to use the whole series of plates. That's all from me. Thank you.
Hello, first of all, let me introduce myself. My name is Erika Louis Adiwati with three last digit name 089. Now I'm going to present about the diagnosis of Ishihara test. So basically, there are 38 plates used in Ishihara test that can be used to identify and diagnose problems with color vision, and there are 6 different types of plates used in this test, which is demonstration, transformation, vanishing, hidden digit, diagnostic, and tracing plates. A demonstration plate is used to start each exam. Anyone, whether they have normal vision or color vision impairment, are able to see this display plate. Next is transformation plate. People with normal color vision can tell distinct numbers while those with color blind cannot. Third is vanishing plate. It is a plate which only people with normal vision can see. While hidden digit plate is the reverse of vanishing plate. Only people with color vision impairment will be able to see the image on this plate. There is also a plate for determining the kind and degree of a person's color vision deficit called diagnostic plate. Lastly, tracing plate requires individuals to trace a line inside the circle rather than looking up a number. That's all from me. Next slide will be presented by my colleague. Thank you.
Hi, my name is Caitlin Nataxia and my last three-digit number is 138. Hardy-Wren-Riddler test. In 1955, Hardy, Wren, and Riddler created the HRR exam or Hardy-Wren-Riddler test. This test is intended to identify trident or red-green color blindness and the severity of the condition. The fourth edition's colors are well chosen to complement the previous version's lines of confusions and isomerism. This version has 14 plates, 10 for deuterium and proton deficiencies, and 4 for trident deficiencies, each with a categorization of mild, moderate, or severe severity. The patient will be asked to recognize a variety of picture forms, such as triangles or circles, like in the picture, and a person who is colorblind won't be able to distinguish the differences in color that a person with normal vision can. In addition to being used to screen for color blindness, this test can also be used to find individuals who have impaired color vision due to other eye illnesses, such as those with optic neuropathy. I think that's all from me. Thank you.
Hello, my name is Dr. Adrianus with the last 3 digits of my SGD number 104, and I'm going to explain about Function Mansell 100Q or FM100Q test. So FM100Q test is also an option to determine whether one has color blindness or not. The test procedure involves the use of a set of 85 color caps arranged in a specific order, varying in hue, saturation, and brightness. During the test, the participant is presented with 2 color caps side by side and is asked to identify the cap that appears different in color. The caps are presented in a systematic manner, following a predetermined sequence until the patient cannot reliably differentiate between them. The scoring of the FM100 test is based on the number of correct responses. The test results are typically represented on CCI or on a color confusion index graph, which plots the participant's performance against a standard color vision deficiency scale. The CCI graph can help identify any color deficiencies or anomalies in the individual's color vision. A higher score on the CCI indicates better color discrimination ability and vice versa. The lower it gets, which means the patient suggests potential color vision deficiency based on the FM100 test.
My name is Adjani Sayidina Pakpahan with last 3 digits of student number 031, and I would like to explain a bit about the Farnsworth D15 test. Aside from pseudo-isochromatic plate test, Farnsworth D15 is the most used test clinicians perform to identify the kind and degree of a color vision problem. During the test, Patients are required to arrange 15 randomly arranged color caps in order of hue. They are given a reference cap as a place to start when arranging the remaining caps in order of color. The number and pattern of errors in the cap sequences plotted after the test, i.e. the number and direction of major crossovers, will identify the kind and degree of a patient's color vision deficiency. That is all from me. Thank you.
Hello everyone, my name is Fiona Natania Santoso with my last 3 digit student number ID are 249. Now I'll explain chapter 3. The conclusion of our presentation, color blindness is a visual impairment that causes an individual difficult to distinguish and perceive colors or color combinations. And the diagnosis is established by doing color blindness tests such as Ishihara test, Hardy-Randall test, Farnsworth Onsel 100Q test, and Farnsworth Onsel D15 test, and it can be performed when there is any indication of color blindness, such as difficulty seeing colors and their brightness in a typical way, frequently encountered color perception discrepancies, and inability to distinguish between shades of the same or similar color. And the advice, color blindness can affect person's educational and career. And by understanding their risk causes and doing the right assessment to the patient, we can improve their perception of confusing colors. And knowing the test method can be used to establish the diagnosis and help patients about their condition. And this research is also very valuable for us, the writers, in understanding more in depth about color blindness. We able to know and make improvements to the test method in the future. Thus, we can help improving the patient's quality of life. Okay, and that's all the presentation from small group discussion B9. We are so thankful for your attention and we are sorry if there's any mistake from our presentation. Thank you.